am excited about today's topic. We are going to be covering the power threat meaning framework. And I will be your facilitator today. My name is Dr. Megan Mitchell, and I am the founder of Agents of Change Social Work, and I obviously present with Agents of Change Continuing Ed as well. So a little bit about me. I don't know why our image is not pulling up. But a little bit about me. I am the founder of Agents of Change. I have been working as a clinical, fully licensed social worker since 2015. So I guess I'm aging myself here, over a decade. Most of my work before going into private practice was with schools. So I was a school social worker for many years. I know there are some school social workers here, primarily with elementary school. I transitioned into group practice in 2022. I opened my own private practice in 2024. And I also, on top of doing Agents of Change, oh, here's my image fully loaded here. So on top of doing my private practice, I also teach at the University of Michigan School of Social Work. I'm a lecturer. And my fun fact is I just never stop going to school. So I have 2 masters and a doctorate. And I say this because I just keep finding more ways to go to school because I love to learn. But my husband laughs that now that I've gotten my doctorate, there's no more degrees that I can get at a higher level. So he's happy about that. But I tell him there's always more degrees that I can find. So yeah, that's just a little bit about me, and how I came about this topic was actually through my teaching. So obviously trauma, like I said, it spans all of the different settings that we work in, right? When I was in grad school, I graduated with my MSW in 2012. Trauma was like the buzzword, right? Like everyone is trauma informed. We're all learning about trauma, right? So I would say in the field, we are pretty solid on being trauma informed. However, this power threat meaning framework was new to me when I started teaching, and I was teaching a module on trauma. How many of you have heard of the power threat meaning framework? This was new to me in the past couple of years. I am so happy that a lot of you have. I'm not surprised because it's a emerging topic, but you are going to hear about it today. And it was really eye-opening to me as a different way to work through a trauma narrative and a trauma model. So I'm not surprised. It's new to many people. It's new to me. We'll talk about what it is, where it came from. It came out of the UK. So it is a UK based model, and it is really picking up steam here in the United States. And you will see how it really is a different way of framing a person's life experience to understand trauma. So we're going to jump in, and here are our learning objectives for today. So you will be able to, by the end of today's training, explain the core components of the power threat meaning framework. That's a very long mouthful, so you will see in the slides refer to it as PTMF, and how it differs from traditional diagnostic approaches to trauma. You will be able to analyze how power dynamics, culture, context, and meaning-making processes influence client narratives to trauma responses. And then lastly, you'll be able to apply the power threat meaning framework informed narrative techniques. So we're going to talk about storytelling and narratives that our clients tell us to support client empowerment, identity development, and collaborative healing in clinical practice. Like Alex has said in the chat, yes, you will get access to these slides. What do I encourage you to do today? I just encourage you to be present. There's going to be times where in the chat, I ask you to share an experience. There are reflection questions throughout. We will watch a TED Talk talking about narratives. So I will try to keep it as interactive as possible. So all I ask today is that you come with an open mind and you share in ways that you feel comfortable. Okay. I want to make sure I have the chat up. So if you guys have questions, I can see that. So I'm just getting myself situated. Okay. So what is the power threat meaning framework, PTMF? So this is I'm going to say it's newer. It's newer because it came about in 2018. So that to me is newer. It was developed by a team of psychologists, Lucy Johnston and Mary Boyle, and they're out of the UK. And they came up with this framework, right? We know frameworks are always developing as a way to understand why people express distress, right? We know that people do not exist in a silo. There are systems, there are stories, there are narratives, there are many different factors that are at play as to why someone might be experiencing distress. So they saw, okay, there's many forms of distress, confusion, fear, despair, and it's a spectrum, right? There might be some people that present more on the mild end of the spectrum and more people that present on the severe end of the spectrum. So why they came up with this framework is they wanted to move beyond the illness-based model. And I know there's a lot of talk here of we have the DSM, right? And there are strengths and weaknesses to the DSM. They used this framework to make sense of people's distress. So instead of here's this diagnosis that you carry, it's what has happened to you in your life, what experiences have shaped how you operate in this world. Okay. There are going to be a few buckets of different topics we talk about: power, threat, meaning, and strength. And this is going to come into one framework. Okay. Who is this for? Anyone. Obviously, today we are a group of mental health professionals, so we can definitely utilize it in our work, but it is being utilized in other areas, other settings outside of the mental health profession. So in some cases, doctors are utilizing this, educators. It can be used in a variety of different ways: community organizers, advocacy work. What's really interesting about this model, it was made with clients. So we know that a lot of times frameworks, research, evidence-based practices are made without input from those that it's applying to. So this framework, they took users, they took clients, and they developed this together. It can be used here, like I said, therapy, peer support, self-reflection. You might be thinking of yourself within this framework as we work through the different pieces today, because it really is a tool. It is a tool to help us make sense of people's experiences. So, what is it, right? We're going to keep talking a little bit about what helped shape it, and then we will go into the different components of it. But like I said, it's supposed to be a alternative to psychiatric diagnoses, alternative to DSM. It was developed to explain things better than just diagnosing, right? It suggests this model, which I think we all know, but the DSM does not really give us the space to discuss this, is that when people are in distress, there's often a reason why, right? It could be because we have coping mechanisms, we have defense mechanisms that are shaped by our environment and are shaped by, some is genetic, right? Some of us are just more predisposed. But what this model is trying to do is move away from just, this is your medical disorder. You are someone that experiences depression, right? There's way more to it. It's more nuanced. So this really gives more depth, I would say, to a medical disorder, a medical or a psychiatric diagnosis. Instead of just, how many of you have to get out the DSM? I'll just open this up to the chat. How many of you have your little handy dandy, probably DSM, the desk version, or you could pull it up, or I don't know if any of you remember those old school tabs that you would have in the DSM, but how many of you have that somewhere in your workspace, right? You got to go and you got to say, do they have 5 of 7 symptoms, right? A lot of it is we're finding, do our clients meet symptoms, right? Do they meet criteria, right? And this model says, okay, we're not going to be labeling or putting symptoms into criteria. Let's listen to people's life stories, right? And yes, they might have these symptoms, but we're more interested in how they came about to develop these symptoms. So it's not to replace the DSM. I think it is an alternative. And we're going to talk a minute in about why do we need the DSM? What are some strengths? What are some weaknesses? Okay. So why was this created, power threat meaning framework? Many health practitioners feel that there's limitations in the DSM. Diagnostic systems, spoiler, right? Western medicine, we often like to treat symptoms, right? What happens when we go to a doctor? What are your symptoms? Here's a medication, right? So diagnostic symptoms are often treating problems, ignoring the social and the personal factors, right? Here's a medication. Okay. That doesn't help us understand trauma. That does not help us understand inequity. It does not help us understand systemic problems that have been weighing on this person. This model, the power threat meaning framework, shifts from what is wrong with you, so tell me all the things that are wrong, versus what have you experienced? What is your story? And why does this model tie into what we're going to talk about in the second half of our presentation today? It allows for storytelling and personal meaning making, right? So it can feel really overwhelming when someone gets a diagnosis. It can be stigmatizing. There can be shame. However, when we're working through this framework, when we are giving clients the opportunity to explain what has gone on in their lives, they can start to create their own personal narrative, and it gives ownership and it gives power, right? So they become the active agents who are understanding their life circumstances and not just a quote unquote patient with a disorder. Okay. Someone asked about insurance. We're going to talk about that in just a minute, and why we need the DSM. Okay. So yes, hold on to that question, because no, insurance companies do not recognize this, which is why you have to use it in conjunction with the DSM. Okay. DSM-5, right? I'm sure we all have seen it. DSM-5 TR, right? They're always coming up with new additions. They're always tweaking. What are some weaknesses that we know exist with the DSM, right? A lot of and this is according to the creators of this framework, what they found were some weaknesses. They found that most psychiatric diagnoses assume that there's some biological component. However, that's not always consistent, correct? Right? Like, how many times does someone meet criteria for some disorder and they were not born biologically like with these symptoms, but due to their life circumstances, due to, all the systems at play, they do meet criteria for that. So that was one weakness that these authors found. They feel that it's too oversimplified, right? We're just reducing someone's story, someone's pain, someone's distress as symptoms. However, like, that's really dismissive, right? To just say, do you meet criteria? Let me just get my little handy dandy manual out, and yep, you seem to. So they feel that's just too simple. It's much more complex than that. We know this to be true, that there's limited attention to social factors because you are just matching criteria, right? So trauma, poverty, inequality, relationships, power dynamics, we know that can influence people, and that's often overlooked, right? I often say go into, let's say you went into a neighborhood that is low resourced, possibly community violence, poor housing. How many people do you think if we got out the DSM would meet criteria for PTSD? A lot, right? So the DSM does not help us in determining why are we seeing these symptoms, right? It just says you meet criteria, okay, right? But we need to know more about the systems that are at play. This is also a weakness or a criticism of this model. Many people meet criteria for multiple disorders. How many times do you have clients that say, I think I have this diagnosis? And they'll come to you, they might have done some research and they think they are going to self-diagnose themselves, right? What they're like, do I have this disorder? I tell my clients, if we got out the DSM and met any person, we're probably going to meet criteria for something in that DSM, right? Because we are just matching symptoms with diagnosis, right? So I tell clients a lot of times, yes, for billing, I have to give you a diagnostic code, but I am more concerned about hearing your story, right? So also, how many people would have, if you got out the DSM, I don't know if you do this, but like if you were to diagnose yourself, right? Like we probably would meet the criteria for multiple diagnoses because there's such a high overlap. And it doesn't necessarily fit perfectly with what is happening for people. And it pathologizes normal reactions. What is a normal I will ask you, what is a quote unquote normal response to trauma? Avoidance, numbing, right? Like a lot of things that would be a criteria to meet a diagnostic disorder, right? So what these authors are saying is a weakness is a lot of the symptoms that you find in the DSM, these are normal responses given the circumstances. So why are we pathologizing something that is probably someone's normal reaction? So those are some of the weaknesses that the authors found with the DSM. Okay. I'm going to ask this in just a second, but I will tell you, insurance companies aren't going to say you did the power threat meaning framework with a client and I'm going to accept this, right? We have to do the DSM. We have to use the DSM for a variety of reasons, but that is what is the common language used to get reimbursement, right? You might have your own feelings on the DSM. It's something we have to work within, right? That's just how we operate right now in the United States. So I'm just gonna first ask in the chat, what are some barriers that you find with the DSM as a way to diagnose? We've talked about what the authors think, but in your own practice, what do you find are some barriers? I find it very, you have to do it right. You meet a client and you have to come up with a diagnostic code within the first meeting if you want to bill, right? That doesn't give us much time to come up with a conceptualization. It actually forces us to diagnose and find some sort of criteria to fit them into quickly. Labels, yes. Too soon, limiting, pigeonholing people, right? Also, how many of you have had to fight insurance companies because they're like, you can only do adjustment disorder for so many months, right? Then you have to move into a different diagnostic. So it is a lot of like that someone said, pigeonholing us into different boxes of diagnostics. Yep. I have some clients that are saying my insurance won't cover my child has ADHD. I'm just giving an example. And we need to work on executive functioning, but insurance isn't going to cover executive functioning, right? So like, what do I do here? The DSM dictates what we can bill, what insurance will pay for, right? So that's that. You all are listing very good barriers, right? Lack of context. Also, we meet clients. Obviously, we can always change our diagnostic codes, but think of the therapeutic relationship and how much information we get in the first time meeting a client versus 6 months, 9 months, a year down the road where more and more information is coming out. So there are a lot of criticisms. There's a lot of barriers just because it is a very standardized approach to diagnosis. Why do we need it? Why do we use the DSM? So we talked about the criticisms, but we do use it in this where we are currently at, we have to use it. Why? Why do we have to use the DSM? Insurance purposes, right? What is useful? Billing. Guidelines, yep. Rule outs, yep, we want to rule out other diagnoses. It does give us a framework. We're not operating from zero, so it definitely gives us some structure. I'm thinking, how many of you work on multidisciplinary teams? In the DSM diagnostics is a common language, right? So we all might be coming from different backgrounds. I'm thinking psychiatry, I'm even thinking medical professionals. The DSM gives us a common language, right? This is what we use to standardize our care. So there are, I'm not saying like, you know, there is not need for it. It is the current system that we operate in. So we do need to use the DSM to diagnose. However, what I'm going to be proposing today is how about we also shape clients' experiences from this model that we're about to present, right? I mean, we could talk for hours and hours about how we need to change the insurance industry, and there's a lot of nuances there, but we currently use the DSM to diagnose. That's what we work with, and it's a common language. It's best practice at this time, okay? So just things to think about, right? When sometimes we have to work within systems that exist. So we need to use this to diagnose in our current operation. Okay. Now we're actually getting into the framework. So there are 6 questions that when we are collecting information from a client, we want to consider. So power, threat, meaning, threat responses, power, resources, integration, and narrative. We kind of start from step 1 and build up to step 6. So when you are working with a client, you're collecting information using this framework. These are the questions that you want to ask. What has happened to you? And we're going to go into each of these into more details. This is just the general overview. What has happened to you in your life, right? How did it affect you? So I was raised, I'm just giving an example. I was raised in a single parent household, and it affected me by having to rely on family supports more, like grandparents, aunts and uncles, right? What sense did you make of this? How did you understand the circumstances in your life? How do you make meaning out of this? What did you have to do to survive? We think that we are human beings, right? We often do things that make sense for our survival, right? That's evolution. When someone is, like I say, right? Fight, flight, freeze. Why does that exist? Why do those responses to threat exist? To keep us alive, right? It makes sense that fight, flight, or freeze, fawn exists. What are your strengths? What is a source of power in your life? Instead of power playing negatively on you, how do you use power as a protective factor? And then what is your story? So we have all these things going on. How did you tell me your story? You are the owner. You are the agent of your story. So we will talk about, we're going to break these down a little bit more. But for those of, I'm just going to quickly, before we get into more details, how could you probably actually integrate a lot of this into your work now, but how do you see this possibly being used in your work with clients? And I know we all come from different settings, but like, how could you see this framework being used? Goal setting, building rapport, treatment planning. I'm thinking this could definitely shape your intake, your assessments, right? It's great for case conceptualization. There's actually, when I was researching for this, newer, there's some research coming out that it could be really powerful actually in supervision when supervisors are doing case conceptualization with clients and with supervisees around client work. Helping parents understand. We are going to get into this, and if you have mentioned it yet, intergenerational trauma. How could this help make sense of intergenerational trauma? Patterns, right? Oh, I guess I didn't see that as a pattern of intergenerational trauma, right? So it really lays it out here to make sense of what was going on in someone's life. Someone brought up something really nice here, reduces shame. Yes, right? Instead of, yes, you meet criteria for this, it's tell me about what's gone on in your life, right? It's a very non-threatening way to collect information. It could be used as a strengths framework. Yes, I think it is a totally strengths-based framework. It is definitely a protective factors-based framework, which I think as mental health professionals is so important. Okay. So let's jump in a little bit more power. This is one of the first, let's call it tenets of this framework. So what has happened to you? How have different forms of power shaped your experience, right? Power, we know power dynamics are everywhere. There's no avoiding them. How have systems had power over you? How has culture had power over you? How has someone or a system or something had power even over your own body? Let's think of that. What systems have power over our body? Think of that. That's like kind of a deep one. Patriarchy. I'm thinking women's health, right? I'm thinking those with chronic illness and they are under medical treatment, right? They feel very powerless, like I am just getting all of these treatments. Money, medical, yes. Culturally, yes. Absolutely. So here's some questions you might want to ask your clients when you are trying to understand the sources of power in their life. Who or what has had power in your life? How has that power been used? And this is not necessarily saying power is always a good or a bad thing, but was this power dynamic helpful or was it harmful? I think that's where you get a really good amount of information. And then what situations made you feel powerless or silenced? I work with children. How many of you also work with folks under 18 years old, minors? I saw a lot of people in the chat. How many times do you get clients that are under 18 saying, I feel like I have no autonomy to make my own decisions? Adults are always telling me what to do. Yes, we all were a child at one time, right? We didn't skip childhood. So as part of just being a child, we are powerless. And we have been powerless at times in our life because we don't have the power to make possibly like consent to different things, right? So that's just an example. But this can be applicable to any age. This does not actually have to only be used with adults. So the next part is threats. So the step 2 or tenet 2 of this framework is how did it affect you? So say I'm meeting with a teenager and they say, you know, I'm in a system where I don't really get to make too many decisions. My parents have to consent for everything that I do. Threat is, what kind of threat did this create? How did power that was maybe misused, or sometimes it just is, right? It doesn't necessarily always have to be a negative thing, but how did this create a threat for you? This could be an emotional threat, a social threat, physical, financial, or psychological threat. Questions to ask to understand the threats a little bit more. What kind of danger, fear, or loss did you experience? It could be loss of control. It could be fear of safety, fear of security, threat to self-esteem. I love that. It doesn't necessarily have to be those super obvious ones. They can be a little bit more nuanced. How did those experiences change your sense of safety? It could be mistrust. It could be your loss of identity. some people operate in a place where they never feel safe. That is how they operate, right? And then what still feels threatening or uncertain about that today, right? These are obviously some greater, deeper level questions. You will need to tailor them based on who you're working with, right? You might not have some clients that are here yet in their experience to be able to answer these, but you can tweak them in a way that makes sense to collect information. And how many of you work with clients that they're not here yet? Maybe down the line we are getting here, but we are too much in survival mode to even be able to do this like reflection piece. So just know that too, right? Like some of our clients are not here yet because we are in constant safety mode. Okay. The next is meaning. So this stuff happened to you, right? These experiences happened. What has this done to form your beliefs, right? I'll ask you all in the chat. If I lived in let's talk about, maybe you are in a community or have a client that's in a community where there's constant community violence. What beliefs might be formed from living in a constant state of being vigilant about community violence? What might be a belief or a narrative that client, the world is not safe, or like every environment that I go into, I'm going to have to be on high alert, right? It is what it is. Someone will hurt me. The world is bad, right? I'm just giving generalizations, but that forms our beliefs, right? We all have beliefs, and it's generally based on life experiences. So we create meanings to survive. Back to that example, why might someone have the belief that I'm not safe? How would that help with survival? Or it is what it is. Let's use that. That's a really good example. It is what it is. How does that help us create a meaning to survive? That this is just, it is what it is. This is my reality. Softens the blow, right? That's a great response to that. How else does it is what it is help us create survival meaning? Normalizes, right? This is my life. Yes, these are great. These beliefs often protect us, whether it's subconsciously or consciously, right? It's also a form of accepting, like this is just, it is what it is, right? Oh, someone said stop putting energy into things we can't change, right? It is what it is, right? I feel powerless is what I hear when I am making meaning of that. So questions you could ask under meaning: what did you tell yourself about what happened? How do those beliefs shape your identity or self-worth? Let's go back to the same example that we're using to thread here. If the belief is that it is what it is, I live in unsafe environments, how might this shape identity? How might this affect self-esteem? No control, right? You might feel very poor self-esteem because what's the point? Have you ever had any clients say to you, what's the point? I have that happen often. I feel powerless. I feel like I don't have autonomy. I don't have agency. So what is the point? Right? So this definitely affects self-worth and self-esteem. And then what messages from society or family reinforce to those meanings? What, in this case, what would society, what are some beliefs society puts or family might put on this situation? This is where you might hear, living in these types of environments will make you tough. Deal with it, right? Grit. How many of you have heard this word grit? I hate the word grit. I hate it so much, right? Like it normalizes, for me, I don't like it because it normalizes really bad experiences for people, right? God gives it to battle that, like, you are getting put through this because you can get through this, right? So these are all things that are messaging that people get throughout lives. And why do people say this? You can get through it, you're resilient. It's because we want to have, it helps us create some sense of normalcy, some sense of meaning making in situations that feel very hopeless, right? People are giving all these things. Tough times don't last, but people do, right? We hear all of these things. These are not things that we've never heard before, right? Why do you think we have these sort of phrases that kind of help people through? it helps us make sense of really out of control situations. They're coping mechanisms, right? So it makes sense why we have these different narratives. People interpret experiences in different ways. So this is what I like about this model is you could have, let's think of that same neighborhood that's experiencing community violence under-resourced. We might interview 5 people and they all interpret things differently, right? However, what are some meanings people might make from their experiences? I'm not good enough. I am unsafe instead of my environment is unsafe. People cannot be trusted. I am powerless. And this helps us understand why there's distress. If you're always feeling on edge, if you're always feeling you have to be hyper vigilant, you can't trust people, would you think you'd probably be in some level of distress? Yes, right? So it makes sense why distress would occur. Threat responses is, so what did you have to do to survive? So instead of having symptoms, this model says these symptoms were really just responses to keeping you alive, right? Every response, even self-blame, anger, withdrawal, makes sense for some sort of reaction, right? So what helped you? So let's once again back to that example that we're using. So say this person starts maybe self-medicating with alcohol or drugs. How would that maybe make them feel safer or more in control? How would this help them with what is going on? Dissociation, right? Numbing out, taking the edge off. I can't sleep, I can't cope, but this helps me, right? So there are generally we can point to when we see symptoms or behaviors why it's working for that person. Maybe in the grand scheme of things, we don't see it as working for that person, but there was a decision to do it because there's a reason why they're usually doing it. How did you protect yourself or others? And then which coping strategies help them but hurt now? What's an example of a coping strategy someone could have used that was helpful in the moment, but looking back, it's not that helpful? I mean, alcohol use could definitely be one, but what are other coping strategies that were survival techniques, but could be harmful? Self-harm, isolating, lying, fighting, isolation, right? Denial, fawning, avoidance. We're going to talk about all of these, right? Fight, flight, freeze. Avoiding, I'm just going to get out of the situation completely. Shutting off from other people, pushing others away, building walls. So, or opposite, throwing yourself into more like promiscuous behavior or risky behavior because that gives what? A good dopamine boost. And that helps me feel good for a short time. So that's what threat response is really. Becoming cynical. Yes, I like that one. So these are all things to think about with threat responses. This is just an example of when we see behaviors, what could be the threat and why did this happen? I really like this quick little chart because it helps make sense of. I worked with kids, so they're like, oh, they're an aggressive child. And I'm like, well, what does that mean? They're 8 years old, right? Like why they're doing this for some reason. So aggression, the threat could be bullying, feeling unsafe. And why do we do that? To stay safe and keep others away. If I'm aggressive to you, you'll stay away from me. Skin picking or numbing. So you might have some clients that do some body repetitive behaviors. This could be biting nails. This could be skin picking. This could be self-harm. What might be the threat? I don't feel like I have control. I lack agency, or I'm just very anxious. And this is a coping. What does this do? It helps us regulate, right? How many of you have poor habits like fidgeting, or I'm a nail biter myself, right? I do it when I'm bored or I'm stressed out. And I notice that about myself. It's like we have these, right? It helps us regulate at some point. I have a 1-year-old at home. I don't know if any of you also have kids at home. Like, why do kids thumb suck? Why do kids like want their pacifier? It's to regulate, right? It's soothing. It's a soothing mechanism. Unusual beliefs. So this is kind of where we get that meaning making. But what might be the threat when someone has very unusual beliefs or beliefs that don't really fit with reality? So that's often when we have severe trauma. We know that trauma affects the brain or severe isolation. And why might they have these unusual beliefs? And I'm talking here where we maybe start to get some quote unquote like superstitions, or I have to do things a certain way because it's going to lead to this outcome, that magical thinking. It's often because things never made sense, but this helps me feel like I can make sense of things. Isolation, what might be the threats? I'm going to isolate so I can't be rejected, right? Or I'm feeling such large grief that I'm just going to isolate. How does that help us survive? We're avoiding, right? Why do people isolate? To avoid. It's easier to avoid. Someone asked, would hoarding be an example? Absolutely, right? Like people do, once again, people do things usually for a reason. So hoarding is generally something that if you were to like look at hoarding or go into someone's home that is a hoarder, there'd probably be a story behind that, right? Overworking or perfectionism. So this is kind of that overcompensation. What would be the threat? I have to overperform because I do not want to fail. So if I just overperform, I can never fail, right? And why is that a survival purpose? Because I want to prove I have value. I need to feel secure in myself and my self-esteem. I really like this. I often encourage you, if you do see behaviors with clients or you're working with supervisees or you're trying to make sense of something, use the threat and survival model. It helps make a lot more sense of things. Okay. Power resources. Now we're moving to strength space. So what are your strengths? How have you been resilient? What has shown you empowerment? Even in struggle, I mean, this is all not negative, right? People are resilient, probably because we have to be, right? So people use creativity, courage, connection. Even in the worst of times, you're really in the thick of things, like people are resilient. There are positives, there are strengths to build upon. So questions to ask. You had all this stuff going on. What helped you keep going? You're here today with me. What got you here? Who supports or inspires you? Usually there is something or someone that someone's like, I really I look up to this person. And then what skills or qualities do you rely on? I encourage, like, with people, you're here today, right? You came, you want to change the pattern. Or I'm trying to think of that has made you we'll go back to our example. A client that has lived in constant community violence, what could be a skill or a quality that they rely on? A positive skill or quality that they rely on given that situation. Oftentimes they're protectors, right? So like you have now developed into a protector for your family, right? Like you are loyal to your family and you want to protect the safety of your family. You are alert, you're aware of your surroundings because you had to be, right? So yes, that is the situation you lived in, but these can serve you as good skills in other situations. Okay. Integration and narrative, this is the storytelling. So what is your story? All of this has happened to you. What is your story? Helping them understand this and see these different pieces gives people power, dignity, and meaning. So you just described all these different things to me. How does this fit together for you? If you were to tell me the story of your life, what would that sound like? Who would be included in your story? What events would be included in your story? And this is your story. So how would you tell it in your own words? And then when you have put your story together, what opens up for you? Are there things you didn't maybe see before once you're making meaning of this? So why does this integration and narrative, the storytelling piece, that's going to be part 2 of our 2-hour training, is how does this help? It helps make meaning. We've talked about that, but it reduces self-blame, right? Because people think that sometimes they think their experience does exist in a bubble. Like I'm the problem that all these things happen to me and my luck is awful. Like nothing good's going to come my way. That's reducing when we're putting things into their stories into a narrative here. It's recognizing strengths. It's building from a strengths-based model. And it's more hopeful personal narrative. Because it's like, you know what, you are here today to telling me your story despite all of those really tough times that you went through. And we need to like celebrate that, right? This shifts identity from I am a patient with depression. I am a patient with schizophrenia too. I'm someone who has survived very difficult experiences, right? It's definitely shifting. It's shifting the diagnostic, something's wrong with you model to there's a reason why we are who we are and we behave the way we behave. Okay. How might you use the PTM framework in practice when working with individuals or families affected by trauma and intergenerational experiences? So you all are working in some setting, right? But how might you use this when you're working individually or you're working with families or someone that's had intergenerational trauma? We talked about it a little bit before, but like specifically, how might you see using this framework? Ooh, someone said in corrections, helping them connect their substance abuse and criminal histories. Yes. That's a great example, right? Because what does society say? You did this crime, you're a terrible person. That's a narrative. Building up confidence, normalizing trauma responses. Foster children who lack self-esteem. Yes. It's really helping people see the bigger picture. I think it's great for looking at patterns too. You are not defined by your diagnosis. Absolutely. I tell people that when they're like, I really want to know, do I have blah, blah, blah diagnosis? I'm like, if it's important to you, yes, we can go through the DSM and see if you meet criteria, but why is that important to you, right? Oftentimes it's to validate that there is something wrong with them. That's what I see when people want to self-diagnose. And sometimes, I don't know if this ever happened to any of you. You get a client and they're like, I'm certain I have this diagnosis. You go through the DSM criteria. Yes, you meet criteria. And like, I told you so, right? It's almost like a self-fulfilling prophecy that something is quote unquote wrong with them. Do you think integrating this model into trauma work could improve understanding and healing, or might it create practical challenges? So I think, yes, I'm going to answer that question for us. It definitely can help understanding and healing, but what might be some challenges of using this model? Think of the setting you work in. Where might you run into some challenges with using this model? It's time extensive, right? What if you are in a setting where you have one session with someone? That might be very difficult to enact this model in a short time sensitive. So that to me is a challenge. What are some other challenges? So this is oftentimes like long work. Someone might not, like we've talked about, someone might not be ready for this work yet. What if someone's in constant crisis? We know about like when someone's in constant crisis, are they able to access this deeper thinking, this deeper reflection? No, right? This could actually be really long-term work. This would be the end result, right? Is that we've worked through this model, but it could be that we don't have the gift of time, right? What are some other challenges specifically in your setting could you see? Yeah, it's not medical enough. That's what insurance is going to tell us, right? Different perspectives, right? A medical doctor might say, that's great, but what is the medical diagnosis? Because that's where my framework works from, right? Resistant from higher ups, other team members. Think of training. This might be a lift to train people in this. And how many of you work in an agency or have worked in an agency where like they're very resistant to change? We do what we do because we've been doing that forever, right? Oh, that's a really good point I didn't think of. Like, what if someone's disclosing their trauma and now you have to get child and family services involved, right? So there's that risk too. I don't want to open up because this could lead to worse outcomes. That's a really good point. High caseloads, high turnover. Absolutely. Just things to think about, right? That like, wouldn't it be great if we could just have unlimited time with our clients and do the power threat meaning framework, work with them? Yes, but that's not reality, right? So just things to think about. This, you can just Google power threat meaning framework template if you are more of a visual learner. This is like a great way to do a case conceptualization. I actually, in my class with students, give them this framework, give them a case study, and they have to fill it out. But this is, like I said, you can just Google it and you will find the PDFs there. It's created by the founders of this. And what's the power? What are the threats? What are the meaning? What made things better, worse? What bodily reactions did you have? We didn't go into this when we just went through, but bodily reactions are really important. Oh, I got stomach aches. I was sweating. I was having pain, right? Like, I think a lot of times we don't talk about bodily reactions, and people with trauma often live outside the body, right? Why? To dissociate and that's their response, right? What are your strength and power resources? And then giving them the space to tell their story, to get their story out. This is just for visual learners. If like you have all of this stuff, right, you're doing a case conceptualization, if you want to make it a little bit more clear in your as a way to kind of help. I think it's helpful too, just when there's a lot going on in a case. I could see this being helpful when you're working on multidisciplinary teams. So you all kind of are conceptualizing from the same template, right? Just to kind of have everything out there laid out for you. Okay. Let's take a look at major depressive disorder. Let's take the DSM look, and let's take the power threat meaning framework look. Remember, we need both of these in the current system that we work in. So DSM. Okay, do you meet DS? Let's go through the process. Starting point is, do you meet criteria? Okay, do you have depressed mood, loss of interest, fatigue, sleep? You're going through all those criteria that are listed in the DSM. I'm saying, do you have suicidal thoughts? Has it lasted at least 2 weeks? Okay, you meet criteria. You meet criteria for major depressive disorder, and this is a mental illness that affects your mood. Okay, from the DSM model, this is going to be assume that this is a disorder that you have within the individual, and our goal is to make you not depressed anymore, right? So yes, therapy, I'm glad that is listed here, but medication might be the first line of defense, right? Now let's take this same disorder and put it in this new framework. Where do we start? What are your life experiences? What circumstances have led you here, right? So instead of saying, do you experience fatigue? Do you experience sadness, loss of interest? I'm going to be asking things like, how did this affect you? How did you make meaning out of your experience, right? Oh, I have low mood. How do I explain this? You probably have low mood as a response to trauma, social isolation, poverty, and relationship stress. It makes sense that you would have low mood, right? So here, their behaviors and feelings are understandable responses to life threats or hardships. What's the goal here? Let's unpack this, right? You've had these experiences. It is leading you to have a low mood. So how do we find coping mechanism, right? We're not changing the circumstances people came from. We're not saying here's a pill, right? I'm not saying this is anti-medication. They definitely may need medication, but from our perspective, this gives them room to understand this diagnosis. Just looking at these two next to each other, what comes up for you? Open-ended, right? Limited, more possibilities, more opportunities to make sense, right? And yes, this is what I'm saying. These can go together and they should go together, right? Absolutely. So now we are going to talk about intergenerational trauma, making stories, and we're going to actually watch a TED Talk and kind of talk about how this framework can be used to understand how people make sense of intergenerational model. So all of what the next slides are going to cover is a study that is a very recent study. You can see the citation at the bottom. It's a 2025 study, but it's talking about intergenerational trauma and storytelling in Black families. It's a really great article that they worked with Black families, and they collected all this information about how do families process intergenerational trauma, how do they talk about generational trauma, and how do they heal from intergenerational trauma. So what is intergenerational trauma? Trauma experienced by one generation that affects later generations, children, grandchildren. I'd like to say that most trauma is intergenerational trauma of some level. The severity differs, obviously. But what can trauma influence? Emotional distress, family relationships, right? If there's intergenerational trauma, that's definitely going to affect how we interact with others, and then increased risk of mental health, right? We call it transmission, but what does this really mean is that family dynamics shape us. So family dynamics, parenting styles, emotional environments, that all shapes who we are, right? So intergenerational trauma exists. Okay. So racial trauma and historical trauma. There's intergenerational trauma, there's racial trauma, there's historical trauma. They all tie in together here. So this is known. Black communities in the United States have experienced long-term trauma due to racism. They still continue to experience long-term trauma due to racism, systemic racism, systems of oppression, right? What are some of these sources of trauma? Structural racism. So there are systems set up that were designed to benefit white males generally. We know that African Americans and Black communities experience discrimination at higher rates. They experience violence in their communities at higher rates. Medical neglect. This is a huge one. There is a huge distrust of the medical system because these systems have failed Black communities historically. So they can create race-based traumatic stress, which affects individuals and families across generations, right? People don't exist in a bubble. We exist in families. There's family dynamics. These narratives shape when people go on to have kids or how they interact with their family members. So it all is connected here. Storytelling as yes, currently I'm sure there's going to be research in probably about 5 to 10 years about Latino families going on with the current administration and what's currently going on with ICE and family separation. I'll be very curious to see the empirical data that comes with intergenerational trauma. So thank you for bringing that up. Storytelling. This is a way to protect people or to process people from trauma. To process trauma as a protective factor, should I say. However, are our clients always willing to tell their stories? No. Why might our clients not be willing to tell their stories? It's painful, right? That's in the past. I don't need to talk about it. That's in the past, right? Guilt, shame, loyalty. Some might not have the words. Vulnerability. Generational, right? Like we don't talk about, like there's the stigma, right? Around talking about hard things. It's normalized. I don't need to tell my story, or I don't find the benefit. Repercussions, absolutely. ICE, DACFS involvement. I'm not going to be understood. What's the point? That's that distrust. So that might be the barrier that we have, is that people are not in a place that they feel comfortable telling their story yet, right? But this study is showing that it's actually a really positive coping processing technique to tell your story. So people can process their emotions through storytelling. You can actually strengthen family connections through storytelling and create understanding by telling your story. People who participated in the study described storytelling as a way to reflect, feel supported, and validated. It makes sense, right? How many times have you held something in? It could be a big trauma or a little trauma or something small, and just getting it out, getting the words out feels cathartic. right? Like we know that sometimes just getting it out is what we need. So storytelling is what we're going to move to, of how do we encourage, or how do we get to the storytelling part of processing trauma with our clients. It can be cathartic. I just said that. I was prefacing for myself. It's cathartic and complex, right? It's not just, okay, tell your story, everything's great. It's also very complex, right? We have to consider a lot of things here, right? It has to be a safe place. They have to feel emotionally safe to tell their story. We don't want to create, and not just anyone should be, just tell me your story, right? It should really be someone that is a trained professional when you are working with clients with trauma. You don't want to further re-traumatize a client by having them, by forcing or like pushing, guiding someone to tell a story that's not ready. It can be emotionally complex. Some of the participants in the study felt that by storytelling, they were more connected to their family history, right? How might telling your story help you feel more connected to your family? Shared narrative, right? Think of just storytelling in history. People have been telling stories from the start of when we know that there's been humans, right? It's a way that people connect. However, so this is where the complexity comes in. Some people in the study felt they were burdened by the trauma that their family shared. So like, this is a really heavy weight that I have to be the bearer of, the burden keeper of. So adult children sometimes felt responsible for breaking the cycle of trauma within their families. What do we think of that in the study, that some participants felt, now I'm the one that's responsible? What might be problematic about that? That's a big responsibility, right? And that might create a whole nother sense of dynamics, that I feel powerless. I can't break the cycle, right? Perfectionism. I have to overcompensate. There's no way we're ever going to get out of this situation. So that's why I say it's cathartic and complex. It never exists just in black and white. Okay. Silence as a protective factor, right? We've talked about this when we were walking through the framework, but what did the study find? That people found safety in silence. It's safer to just be silent. So some individuals chose not to share their trauma stories because they were protecting themselves. Makes complete sense given what we know about trauma responses. Avoiding judgment, right? If I don't tell my story, I can't be judged. So I'm going to protect myself that way. And then protecting family members from pain. We're going to listen to a narrative in just a second. And there is part of the story where he says, my dad never told us that he had a mental health disorder. Probably because that father was trying to protect family members, right? If I don't tell them, they don't have to process that. They don't have to deal with that burden. So this shows that not talking about trauma can also be a protective factor. I think it can be a risk factor and a protective factor depending, right? What do you think though, if someone never shares their story, if they're always using silence as a way to protect? What might come up later down the line in life? A lot of distress, right? Like that can create a variety of different things, right? Aggression, sadness, resentment, shame, guilt, isolation, distrust. So protective factor, but also could have long-term effects, right? Which we know is usually what happens with trauma, right? It stays with you forever. How you cope with it and how you process it matters, but it's not that like this never happened to you. It doesn't just go, you're not cured from trauma. Okay. Storytelling in this framework. So we've talked a lot about the framework, but it helps explain trauma by asking how this shaped them. How did this trauma, how did these experiences shape your life? Questions you could ask for families, specifically families that have experienced racism or discrimination. How have systems like racism and discrimination affected your family and your community? People don't just exist in their one family. Like usually you're part of a community. How did this create emotional or psychological threats? How do individuals and families interpret and understand these experiences through stories? You could get 5 families and they're all going to have a different story because they are 5 different stories to tell. And then response storytelling can be a way for people to respond to trauma and build resilience. Family narratives help people make sense of trauma, identity, and survival across generations. How many of you do family work? How many of you do family work? How could bringing the family together and doing some storytelling and some building a narrative be helpful in your work if you work with families? Awareness, connectedness, validation, being together and actually just saying things out loud that maybe have been held internally for so long, right? Everyone's story is important. And I think it's also several things can exist at the same time. How grandma experienced this might be different than how mom experienced it. And that's okay, right? Because we are different people. How can storytelling promote healing? Getting it out. It's cathartic. It is important to make sense. This is the question for you all. We know that there can be challenges. It can be a burden. Is it our role as practitioners to avoid placing emotional burden on younger generations? What do you think? Our role as a practitioner, should we avoid putting emotional burdens on younger generations? And if so, what does that mean? I'll be very curious what everyone's thoughts are. I'll give you some time in the chat. Can we avoid placing these burdens on young generations? So say you're like, tell me your story, and they're like, you know what? I actually feel like now I have a bigger burden because there's all this trauma that came out. Do we avoid that as practitioners? I would say no. What we do, though, is we process with our clients, right? I don't think we can avoid it. I think that would actually, what do we know about avoid when our clients avoid, right? Why are we avoiding? Without confronting things, we can't move forward. So it's about processing and creating a safe space. But I don't think that we can avoid it. I mean, some people will choose to avoid it. If this is something that's uncomfortable for you, seek supervision, right? Talk about why this might be uncomfortable for you. What's coming up for you that you're wanting to avoid it? What's feeling heavy for you, right? But I don't think that it's our responsibility to avoid it or not talk about it. It's our responsibility to support and to process. Does that make sense? Yeah. Okay. Now we are going to watch this TED Talk about storytelling, and it is a TED Talk from out of a university. It's about 13 minutes. I am going to play it now. Hold on. I'm going to make it bigger. The sound should be working, and I'm also going to put on subtitles for people too. Subtitles are on. I'm just going to, it's a 13-minute video, and then we will go ahead and spend the rest of our time together kind of just debriefing narrative making and the power of storytelling. As you're watching this, just be thinking about what are you taking from this speaker? And how does the framework we're discussing today play into what we're talking about narrative storytelling? Okay. Can people hear this? Yes, okay.
As I look out, I see a sea of possibility and potential. Row by row, seat by seat, each of us uniquely woven together as special. We are vessels carrying a cargo that unloads healing capabilities. This is essential. So let us grab our pencils and together trace these dotted lines that connect us. Purpose. We define purpose as the reason for which something exists. How often do we think about purpose? Our purpose. The purpose of the things around us. Let's take light, for example. What is the purpose of light? What does light allow us to do? Why do we need light? For a moment, as we consider these questions, I want the room to get dull, and I want us to observe how this experience changes when light is removed from the equation. I want you to take a moment to consider your thoughts in this time, and afterwards I will ask 2 to 3 people to share with me what you thought about, how you felt. So just take a moment to collect your thoughts. Think about, what are you observing right now? What has changed? As the lights now come back, I want you to collect those thoughts that you gathered. And I'm going to ask 2 to 3 people to then tell me their feelings. You, how did you feel during this time? Yes. Nervous. Why? Got you. Cool. How about you, sir? Yes. Yes. Uncertain. Great, great. Yes, you.
I couldn't see in the dark. It kind of just consumed me.
The darkness consumed you. Wow. Okay. Well, as seen in this demonstration, I believe we only begin to truly understand the power, the purpose, and function of something when they are removed from the equation. As our gentleman just mentioned, the darkness consumed him. It was my junior year here at Brandeis when I studied abroad in South Africa. And there I met Mdu. Mdu was in his early 30s and he walked with a limp. As I got to know him more, we began sharing experiences. He told me that he had polio as a child. He shared his experiences growing up in his community where he faced discrimination. These experiences then motivated him to create the Disability Special Project, which was a gardening project where members who identified as being differently able, they could come and have a safe and brave space to be a part of. Meeting Mdu and hearing his story then convinced me to come back and learn more. When I went back, I met members who were in the garden, and they told me their stories. I remember one of the last questions I asked them: if you were to write a song to the community to help them understand you better, what would you say? They mustn't see me as useless because I can do great things for them. I am strong. I am a human being. I can do things, but they won't let me do them. You see, what I found was that there was a disconnection between this community and their perceptions of themselves and how the greater community viewed them. And I think it was due to an unwillingness of the greater community to now listen to the stories of these individuals. In like manner, I believe a disconnection can also take place when there's an unwillingness of individuals to share their story. And this could be due to instances because of fear. I remember one day sitting in the waiting room with my mother. You see, earlier that morning, we had picked my brother up from school because he complained of something being wrong with his head. As we sat there, I looked over to Mom. There was a tear in her eye. "What's wrong, Mom?" I asked. "Joe, I hope your brother doesn't have the same condition." "What condition?" She said, "Joe, before you were born, your father was diagnosed with a mental condition." "Mental condition? What do you mean, mental condition?" She said, I never really did get a sufficient answer. But you see, this was the man who would drive me and my brother to school every morning and pick us up every evening. This was the man who taught me how to play chess and checkmate my opponent in 4 moves. You see, this was the man who would pop in his favorite classic vinyl CD every Saturday morning and dance with us. What do you mean, mental condition? I was confused. I felt deceived. How could he not tell me? I began to see my dad differently. I placed blame and resentment on my dad. Only years later am I now beginning to understand the mental stigma, the paralyzing stigma that surrounds mental illness. And I believe as a result of this stigma, he was unwilling to share his story with me, which resulted in a disconnection. You see, my dad and meeting him and the members of that community, those two experiences have something in common. In both instances, a narrative or story was removed from the equation, resulting in disconnection. As seen earlier in our example with light, I believe we only begin to truly understand the purpose and function of something when it is removed from the equation. Without light, we cannot see. Without light, we are isolated. We are in darkness. Without light, we are blinded. I believe it is the same with our stories. Without our stories, we are in disconnection. You see, our stories harness a power that can connect us. The moment we stop sharing our stories, the moment we stop listening to the stories of others, is the moment we cut ourselves off from those connections. Each and every day, we are gathering and collecting new stories. And every day we have another opportunity to both share our story and listen to the story of someone else. I believe no matter who we are, no matter where we are in the world, our stories are the thread that connect us together, and we can't lose that. That is the healing factor. You see, at Brandeis, I was a pre-med student, and I am on the journey towards medical school currently. However, no matter everyone here sitting here today, I believe we are all healers. And it is by that fact when we understand the power of our own stories. Recently, when I went back to that community in South Africa, in Sandaneswe, I went with a willingness to listen to the stories of these members in this community. And I found that a door was open. You see, their stories began flooding out at me. And they were so happy to have someone who was willing to listen to them. In like manner, when I started to understand more about this paralyzing stigma that surrounds mental illness, I again began to see my father differently. You see, he was more open to now sharing his experiences with me and his story. And as a result, we became closer. Recently, I came across a video by an artist named Joyner Lucas for his song titled, "I'm Not Racist." And while the song may be controversial to some, I find it as a powerful and perfect example of the power when we share our experience, our stories, our perspective, and listen to the perspectives of someone else, especially if they're different than us. You see, in the first verse, it is narrated in the music video by a white male individual, and he shares his perspective of race relations in America. He ends his verse by saying, "There are two sides to every story, and I wish I knew yours." The second verse then responds, and it is played by a black male individual who then shares and responds with his perspective of race relations in America. And he replies, "There are two sides to every story, and now you know mine." At the end of the video, after the second verse, I believe this is the most powerful point in the video. I see these two individuals get up and they embraced each other. If you could, for this moment, with consent, reach out to someone who you do not know right now. Reach out, give them a handshake, give them a hug, show them some love. All right, great. You see, in this moment, we just shared a connection. And that's what these two individuals did. In that moment, they broke down stereotypes. In that moment, they broke down biases. They shared their perspectives. and a connection was made. Those two individuals, my dad, Umdu, and the members of this project, they all remind me of a concept, a philosophy that I learned about while studying in South Africa. And it is called Ubuntu. If you could say Ubuntu with me, Ubuntu. Ubuntu. One more time, Ubuntu. Ubuntu. It simply means, I am because you are. Repeat after me, I am because you are. One more time, I am because you are. You see, I am, the only reason I exist is if I know who you are. The only way I know who you are is if I've heard your story. You see, Ubuntu speaks to this idea that we are all connected by the simple fact that we are human, that we share humanity. Our stories and our narratives, in which we all have to share with the world, they harness a power that can heal both personally and collectively. Today, as I share this with you now, I am becoming a part of your story, and you a part of mine. Thank you.
I was muted, so I'm going to go back to sharing, but if you are not following the chat, someone said they work with him as a physician, so I'm so happy to hear that he's a physician now and that he's wonderful. So I said she needs to share that we are learning from him here. So I think that's like a very cool celebrity, TEDx celebrity in the wild. So just hearing that, I was taking some notes. What were just some things that you took from this about storytelling before we start to get into some of our reflection questions? Just like, what were some takeaways or some things that stuck with you? And I encourage you to look in the chat and see what others took away from this. Storytelling is very powerful, right? It connects us. All stories deserve to be shared, right? I was thinking how he discussed that community in South Africa where it was a collection of people that had differing physical abilities, and they felt like they couldn't share their story, right? We have to think of systems of oppression and why people might not share their stories. He's a very skilled storyteller, right? And he was very vulnerable, and I appreciate that he was vulnerable in sharing his own story. It creates visibility. Connection is building safety. Yeah. Stories promote connection. I took a few notes. When we remove the narrative, we remove connection, right? So if we don't hear stories, if we don't hear two sides of the stories, how can we connect? We can't. That's what he was saying there. Without our stories, we are in disconnection, right? Giving people the chance to share their story and be open-minded about it. And then he says, was one more thing I wrote down. There are two sides to every story, and I wish I knew yours. What do you think of that quote? Two sides to every story, and I wish I knew yours. It's an invitation, but what is that? How could you make meaning of this, or how might you use this? I want to know more about you. I want to connect. I don't want to assume. I want to hear. Your story's worth telling, and I want to hear it. You are important. I want to understand. How many times have you just had people make assumptions about you or your stories? And what if someone said, I wish I knew your story? Do you feel comfortable sharing it with me, right? What a gift that is. What a gift it is to allow that we are to, I think this is helping professionals. What a gift is it that we get to hear people's stories, right? They feel comfortable sharing with us. That's like a huge thing thank you for sharing that with me. That is a gift. Yeah, it's an honor. It really is, right? That's probably like one of the very powerful things. It's healing. This is really at the crux of what we do, is hearing people's stories, and it's healing. How many of you feel that sometimes your work with clients is healing to you? I feel that often. It can be a very healing thing to be holding space for people. It can be incredibly hard, but it also can be very healing. Okay. Some questions. So I'm thinking specifically to the speaker's father. The speaker did not know that his father had a mental disorder. We don't know what it is, right? But why do you think his father chose to remain silent for so long? Didn't tell his children? Protection. So let's think of it through the framework: fear, stigma, shame. Also, let's think of gender norms here. What are some gender norms that are power structures that are at play for men, and men being vulnerable, and men seeking help? I have to be the provider. I have to be strong. Like, I have to show my sons that I am the provider. Men are supposed to be strong. Nothing wrong. I got this. I can't be perceived as weak. And what is society? I'm glad the narrative, we're moving in a different direction, but what is society's general views on mental illness, right? It's weakness. There's something wrong with you. That goes back to our whole diagnostic discussion from earlier. You can't handle it. There's something wrong with you. You're broken. So there's a variety. We don't know why, but we can assume that he probably did for a variety of reasons. And that was probably to protect. It could have been shame. It could have been doubt. It could have been painful, right? Like, it is. I don't want to say anything because it's hard for me to accept this. So that's our first question to think, or lack of understanding, right? I should have wrote down specifically what he said, but I think they referred to it as a mental condition. Even that language right there, what does that tell you? That it was referred to as a mental condition. It's very, I don't know, medicalized, if that's a word. But when you hear mental condition? Something's wrong with me. It's a label. It's negative. Unfixable, preserving your identity, right? And it's stigmatizing, right? We also don't know like what it was, and maybe the father feared that this could be quote unquote passed down to his children, right? So there's a variety of things that could go into this father's decision to originally not speak about it for so long. The next discussion question. So how does hearing the speaker story about his father demonstrate the power of narrative in understanding trauma? He said he's building that relationship with his father, but how does hearing him say, now my father's starting to talk about it, and he's using this storytelling to we're making sense of things. So how does hearing him tell this story highlight how important this is in making sense of things? Connection building, right? He's forming a connection. It's making them closer. So let's just do like a thought experiment here. Okay. So they're closer now. Their dad's processing this, son's processing it. What do you think could have happened, knowing that what we just talked about, not sharing your narrative could mean disconnection, right? We are connected through narratives. What if the dad never shared his story with the son? Resentment, misunderstanding, betrayal, anger, loneliness, distance. I'm thinking like emotional distance. If this child never had the experience to understand, he's going to create his own narratives too, right? Oh, maybe dad is distant about emotionally because of blank, 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 and blank, right? The cycle does continue by not talking about it. Unfulfilled relationship, right? Self-esteem of the children could also be affected too, right? What did you all think when the speaker said when he found out he was hurt? He was angry and he was hurt when his mom told him that his dad had some sort of diagnosis. He said, not my dad who plays with us and drives us to school every day, but what does that reaction tell us? Right? Denial. I think it also plays into how stigmatized mental health is. Right? Oh, this is a very bad thing. And I think sometimes, well, this was also a child, but we think two things can't exist at the same time. Like you absolutely can have a father who's present and doing all these things, and your father could have some sort of distress or mental diagnosis, right? Someone said stories we are told doesn't make sense. I think that was part of this. This speaker was trying to make, this doesn't make sense to me because I have this worldview, I have this narrative, and it doesn't make sense to me. So a lot here, right? Okay. This, like I said, this was a very skilled storyteller, right? How does he use storytelling to make sense of his experiences? I'm guessing he's using now becoming a storyteller because he sees the power of it. But how for you were you feeling connected to the speaker by his story? I felt, it's bringing up emotions for us, but how does he use storytelling as a medium? How does he use storytelling to make sense? He's saying, hey, this helped me, right? I have seen the power of storytelling. I wanted to share that with you. Emotional universality. Yes. It's probably pretty vulnerable to go up and do a TED talk on explaining this, right? So I think he showed great vulnerability in putting himself out there. Compassion. Why do you think he did this, right? He didn't have to do a TED talk on it, but why do you think he did? Encourage others, right? There's power in this to normalize, to bring awareness to it. Help us show we can build connections, hearing their stories, awareness. Someone said they feel like this was relatable. He shared his story, so now I feel comfortable sharing mine. Yes, someone said, shouldn't we empathize with people who don't have the capacity to tell their story? Yes, or they're not there yet, right? That's where we got to walk alongside this journey with people. Everyone's not here yet, and there's a reason why. So I think part of this framework we're talking about today does help us see that there's a reason why people are not in a place to tell their story. Right? We should absolutely have empathy in people who don't have the capacity to tell their story. There's probably a reason why. We talked about some of the reasons why, right? Fear, especially social work is political. Storytelling can be political. So if I tell my story, I could have repercussions against me, right? So there's absolutely reasons why people might not share their story. Okay. We talked about this, but how might hearing this story help listeners develop empathy or a deeper understanding of trauma? So say that we're talking now to non-helping professions. Say you played this for a family member that does not understand trauma. What might this do for them? How might hearing this man's story help them understand trauma, help them understand the power of storytelling? You might have some clients that are like, I don't want to talk about it, but what if you share this with them? Like, what could this model for them? Willingness, right? Vulnerability. You're not alone, right? It's scary. How many people would be scared to tell their story? It is really scary to tell our stories. Why? What might be fear, or why is it scary to tell our stories? Judgment, rejection, shame, guilt, fear, embarrassment. What if it's something in the past people are like, I'm really ashamed of some of the decisions that I made, right? Or I don't trust people to hold my story right now, right? I don't trust that you're going to have good intentions for me to share my story with. That's why we have to really create those safe spaces for our clients to feel willing to share our stories. This ties into, I know a lot of you are private practitioners or work with clients. Some clients don't understand the confidentiality piece. What would be important when you are in a safe space with a client? What are some important things to tell your clients to let them know of what we can as the clinician? What are some of the limits what is important to tell them that our limits are as their provider? I always like to tell clients, right? This is a safe space, but there's limits, right? We still are mandated reporters. We still are bound to our whatever code of ethics that we are bound to. And we don't do this to discourage, but why is it important that clients know this? Because say they did open up and you do have to report or you do have some limitations, they could feel very violated if they did not know this ahead of time, right? They could feel betrayed. This could totally ruin the relationship. So always back to informed consent. I always say informed consent always and often, right? Because you do want you want to create a safe space, but there also are limits, right? Oh, I love that someone said this gives them the autonomy to share like what they it's their narrative, right? So they're in control of what is shared and not shared, given what they know of what our limitations are. Okay. So we finished a little bit early, but I want to go back to our framework just to regroup on what our framework showed us today. Let's go back to our six questions, our 6 tenets, right? Power, threat, meaning, threat responses, power resources, strength, integration, and narrative. First question, what has happened to you? What influence of power are at play in your life? Remember, this can be individual, this can be systemic. People don't exist in a bubble, so there are power dynamics, power relationships, no matter what. How were you affected by this, right? What did you perceive as a threat? What did your body perceive as a threat, right? Our body sends signals. Our body tells us things. Someone said, do I have the template? Yes, I will send that. We can send the template out as well, the power threat meaning. What sense did you make of this? These things happen to you. Have you made sense of it? Or maybe you're like, what if someone says, I can't make sense of it, right? That's telling us that it feels very chaotic. It feels very disorganized. What did you have to do to survive? Fight, flight, freeze. We talk about this so often with our clients, but there was probably a reason why you did what you did. How did this help you survive? And then what are your strengths? What do you have that we can really focus in on? We are always working from a strength-based thing, right? But then what is your story? Something that I do want to talk about, we're talking about narrative stories, but what are ways that you could allow people to create stories that aren't necessarily using words? I'm a play therapist, so I can give you many, many ideas, but just say you have a client that might not feel verbally confident. What are other ways? Art, maybe they're creating a collage, poems, music. Maybe it's what is a song that resonates with you in your story? Sand tray. Who here does sand tray? I'm a play therapist, so I do sand tray, but wow, is that powerful to get a sensory piece in there. People start bringing stuff out in the sand tray that you're like, whoa, I've done some sand trays too. And just when your senses are engaged, right, you can really go very deep. Music, journals, workbooks, puppets, music, right? There's ways that you can engage with storytelling without them having to use words. And some people feel much more comfortable in that space. Art is definitely one. I use collages a lot. So like, what do I mean by collages? Getting magazines, they cut out and they make whatever sense of whatever whatever it is they want to create. You could even say, this is like the most basic form of having people tell their narrative. Think of this, like if I gave you this prompt, what is an object in our space that represents a feeling that you have right now, right? You will be very surprised what objects people use to represent feelings, right? So objects can be used, a variety of different things can be used. Okay. Let's go back now to our final takeaway. And then we will do our closing and logistics so you all can get your certificates. But last questions, takeaways. How would you incorporate this into your work? It's a new framework for most people, but it's not that new concepts, right? It's just probably a lot of what we do in putting it into a framework. So how would you incorporate this? And how can you use narratives, or how are you thinking about? I always want people to have takeaways, like how might you use narrative storytelling, telling stories in your work? Go ahead in the chat and just, how are you going to incorporate this, and how might you use storytelling for healing? I'm already thinking I need to do more of the storytelling. I'm like, oh, I got to get some of my art stuff out. I really like the Psalms too. I forget that music can be so powerful. Poems, letter writing, a letter to self, a letter to someone else, poetry. What's your theme song? I love that. Why'd you choose this? Photography. Oh, I love that. Like, what's a picture that represents blank? These are all great ideas, right? How many of you are like, I want to share this TED Talk with other people? I'm thinking of ways I can incorporate this either with my students, or I even think with some clients, it'd be really powerful to show this TED Talk as well. Yeah. So basically our key takeaways from today is this does not replace diagnostics, right? I say it's to work alongside with. We've talked about why we need the DSM, but we see here this framework gives us much more depth. It allows us to see clients from a multifaceted, nuanced approach. So, like I said, it's not anything that is really groundbreaking, but I can't believe most of us have not heard about this before. So go into the world and tell people about the power threat meaning framework. We will send out some more, we will send out the template, and I think it's just a really great way to see people for who they are based on their experiences versus like you fit into this diagnostic criteria. Okay, so I hope that you all enjoyed this. I know it was a short time together. I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.